Good afternoon, everybody. We are Team 5, otherwise known as the Comfort Creatures. My name is Christianne Malaty. My pronouns are she, her, and I'm currently in my second year of nursing.
And my name is Israt Jahan, and my pronouns are she, her. And I'm in currently last year of my business program, and my background is from engineering.
Hi, my name is Katherine. My pronouns are she, her. I am in my second year of the new Bachelor of Health program, and I have a background in psychology, criminology, kinesiology, human rights, and forensics.
Hi, my name is Raiyan. My pronouns are he, him. I am in my second year of a Bachelor of Science in Biology.
Okay, improving access. Our team is focusing on improving access. New Brunswick has an endless amount of resources, mostly focused on intervening and less so on preventing. About 38% of New Brunswick's population lives in rural areas. A big part of New Brunswick consists of rural communities, and mental health access is more limited to those who reside outside of the main urban centers. This can be due to lower incomes, travel times, stigma, and a lack of education on healthcare challenges.
Goals. For our short-term goals, we aim to improve awareness of the current resources in New Brunswick, as some can start to immediately help those who are reaching out and looking for help. We also hope to improve emergency room response to mental health crisis. We'd like to continue the conversation about mental health challenges and get it out there so that more people will be comfortable coming forward to seek help and so that they can confide in those they love. We want people to be able to recognize when someone is having a harder time and how to be there for them. Each situation is independent and unique, but the proper education, and we hope that people will learn how to ask what people need during that hard time and how to listen when someone needs it. Our long-term goals include putting an end to the mental health stigma that continues to surround us, because often it is still considered as a taboo topic in the 21st century. Providing community awareness and guiding communities to come together for each other. And finally, we have the graduate and PhD students more integrated into working with students and encouraging them to be an active part of their communities and use their knowledge and skills to educate others.
So one of the major issues that we saw in Han's case was his experience in the emergency room. So he went because he had experienced a particularly bad panic attack, and his thoughts and feelings afterwards of, I don't want to be here anymore, scared him. He didn't know where else to get help. Now, something we can unfortunately not change with $10,000 is the major systemic issue of understaffing and wait times in health centers. Hans went to the ER even if it was because he didn't know where else to go. This means he was ready for some help, and he was taking that major step to reach out. He left without any resources or having gotten any help because of the long wait times. For someone who is scared of their own thoughts and feelings, waiting and sitting in a waiting room for 8 hours doesn't do anybody any good. So I won't touch too much into this point because I understand that it may be a bit upsetting to some people, as it is rather close to home. But a more real-life example of a similar situation is what happened to Lexi Dakin. She was taken in the ER because she was experiencing suicidal thoughts, and they made that step to get help. Sadly, she experienced the same issue with wait times, and she felt like a burden and had experienced some insensitive behavior from staff. She left with a referral, and a few days later, she died by suicide. Now, we understand that emergency departments do amazing work, and in emergency situations, everybody reacts differently, but there has been consistently failed communication and errors made when it comes to helping mental health patients. Next slide, please. So all of this being said, we've created a way for people who have made that step and are seeking help to be able to access resources while out in their community. So we will work in coordination with Horizon and Vitalité facilities. So this sheet that we've created here would be handed out once a mental health patient has arrived into the emergency department. And we understand that words are everything, and staff must express how important it is to have community resources available once outside of a clinical setting. So after patients have been seen in triage, a great way to start the conversation about community resources would be to hand them this sheet, say that this is for after your visit here today, to help you while you're at home. Included are many free resources available to New Brunswickers. There are also phone lines for when you want to talk to someone and may be feeling scared. There is a bit of a wait time here today. We will get you in as soon as we can. In the meantime, if there's anything you need, like a quiet space or someone to sit with, please let us know right away. So we hope for this to be a quick fix while we as a whole work on changing the systemic issues that are still in place. Next slide.
Volunteers. One of the constraints of designing our program is an extremely limited budget, which means a big part of our program is through the use of facilitators and volunteers. An excellent way to recruit volunteers is through our other students, particularly social work, bachelors of nursing, psychology PhD students, masters in education, and counseling students, etc. All of these programs require practicums and/or volunteering as a prerequisite or program requirement. The benefit of having students helping students is a win-win situation. Pressures that all students face with issues from classes, finances, employment, time management, family, friends, and relationships can be difficult to juggle. By having more senior students volunteering in the program, they themselves would understand these issues better than most, having dealt with them themselves. This is in addition to fulfilling their program requirements while also developing more experience in their chosen field of study. Some examples of post-secondary institutes could be involved would be UNB, St. Thomas, Yorkville University, and Dalhousie. Next slide.
Change the stigma. Prevention and early intervention program are really less common in New Brunswick. So we decided a workshop called Change the Stigma, which is a mental well-being workshop focused on you and in your community.
So in this workshop, we will discuss what resources New Brunswick currently has available, because many of us who either grew up here or who have lived here for some time now knew nothing about these programs or even that some of them existed. So we will discuss signs and symptoms of common conditions and how to be there for your loved ones who are experiencing these mental health challenges and/or conditions. So lastly, we will address that they can manifest differently in different people and different populations because each situation and person is unique and it's not always approached in the standard way that is taught. And another big focus for our workshop will be wellness. So this workshop will approach how to put this new information into action in your community, so how to create a safe and positive environment. We will also discuss how to and when to be there for your neighbors and community. Feeling loved and having a supportive community is important, especially during a time like now where we are all still facing such uncertainty 2 years into a pandemic. So leading by example is another key component to this workshop. And once people start to see others talking about mental health, they will join the conversation and they will start to check in on their neighbors and their loved ones.
This workshop will ideally be done on Zoom to reduce costs as well as to create a safe workshop during the pandemic. For those without internet or those who do not feel comfortable using technology, we will have pamphlets that will cover similar information to the workshop sent to them. This workshop will be run by our mental health professional working on our team. They, with the help of our graduate students who bring an amazing student life perspective, will deliver the contents of the workshop. This will be a one-time workshop to start, and then we will send the participants out into the community to put their new knowledge and skills to practice. We plan to promote this workshop by using local radio stations, Instagram and Facebook ads, as well as advertising in local newspapers. We will reach out to rural community centers and health centers to recruit participants and increase mental health literacy, because education is vital to gaining empathy and positively changing our ways of interacting with others. Next slide, please. With the help of our mental health professional, we plan to implement a crisis intervention training program to which law enforcement agencies can send their officers. The CIT program will consist of a 40-hour curriculum, which will be taught over 5 consecutive days. The course will emphasize understanding of mental illness and facilitate development of communication skills, which will better equip officers responding to crises, to triage cases that require psychological intervention, and provide appropriate help to those struggling with mental illness. CIT programs in the Miami-Dade Police Department in Florida have seen positive results, with unnecessary arrests and shootings declining. This will also promote trust between law enforcement and the community, which will create a safer environment overall.
As for our timeline, we expect everything to be play for about a month, and the month starts once we have recruited people for our workshop. Our emergency room mental health resources page is in use, and graduate students are in practicum. Once we start the clock, the workshop will run, and we will send out all the volunteers to go out into their communities to put their new skills into practice. And after that, during that time, the graduate students will be working with students in counseling and well-being practices. After 1 month has passed, we will evaluate the program by gathering some statistics, going out into the communities to see if there is any change, and by interviewing people. If the program has made a positive impact, we will then fundraise and get sponsors in order to continue the program. Before rolling out the program again, we will accept all negative and positive feedback and make changes to the program.
So we had a pretty tight budget this year, $10,000. So we did our very best to use what current resources we had available and use volunteers and everybody on our team. So we're allocating a good amount of our funds towards advertising. So this advertisement includes advertising the current resources that New Brunswick has, as well as advertising for our workshop. And then as well, we're going to be allocating some of the funds towards the CIT program. So in the end, we end up with a surplus of $1,400, and this is kind of a safety net for any unforeseen costs that might arise. So like the need for more advertising, gas money for students, and funding future projects.
We are the Comfort Creatures, and thank you for listening to our presentation.
Fantastic job.
Andrea, you have a question?
I'm hoping that this now works again. Yes. Okay, wonderful. It's not doing some kind of weird feedback thing. Thank you so much for your presentation. That was really interesting. I loved the inclusion of first responders. So one thing I wanted to ask was, you talk about they'll head out into the community after the workshop with their new skills. So what does that look like? How will they be interacting with community members now that they have these new skills? What will they be doing with them?
Okay, so first of all, the way they're going to interact is we are thinking that because New Brunswick is not as advanced as the bigger cities like other part of Canada, so the rural communities are very much secluded from the mental health supports most of the time. So what they will do, they will go into the small communities, and especially in most of the communities, they have community centers, which are for most of the events, community events, they can be hired for free for any kind of thing. So they can go out in those community centers and run those workshops. And from there, we'll include like both the young adults and the adult communities, like the elderly communities, because what we have figured is that mental health is not a lonely thing. So inclusivity is very important, and we figured that family interaction for that one is very important, because oftentimes what happens is that for young people, for example, they are not able to interact with their family members. So teaching both of them together at the same time will actually help them relate to each other and communicate with each other more. then by doing so, it will help them reducing their mental health issues.
As well, just to add on to that, we're also hoping that people will, it's kind of a lead by your actions as well idea. So we're hoping that people will go back to their communities, they will educate others on what they've learned, but they'll also start to put those into action by asking their neighbors how they're doing, checking in on people, like baking them cookies, just like little things that we're hoping will kind of catch on and just create a more supportive environment.
I certainly strongly advocate for the baking of cookies and the disseminating of cookies. Yeah, thank you.
Does anyone else have any questions?
I do. I didn't raise my hand, sorry. I thought it was great. I liked the whole idea of getting in the community and volunteering and getting people out there, like, going to the rural areas, going to community centers where people can't get out, but they can have someone to talk to. And like you said, and something you said, like a simple gesture of just going next door and checking on your neighbor, or like you said, cookies. It's all like, just it's the principle of it. It's checking on people, like and knowing that someone knows that there's someone there that they can go to. So I really like the concept. It's a great job, guys.